Hi, this is Dr. Raj at the Lifestyle Talk Radio Network. I'm your friendly Beverly Hills Orthopedic Surgeon. An orthopedic surgeon is a surgeon who treats and operates on bones, joints, and muscle injuries, of which we all have. Now, we have a caller online, Brandy. Brandy, how can I help you today? And where are you calling from?
Evans, Georgia.
Okay.
Well, I was in a car accident a few months back, and I'm still having back pain from it.
And first of all, how old are you, Brandy?
I'm 23.
23. And at the car accident, what happened? Were you rear-ended or?
No, we ran right into the car.
Okay. And did you have pain right away, or did it come on the next day?
I had pain right away.
Okay. Any numbness or tingling down your legs?
No.
And did you go to emergency room afterwards?
Yes.
Okay. And what's prior to that, your back was okay, no issues?
Well, I've always had a little bit of back pain, but after the accident, it's constant now.
And what treatment have you had so far, Brandy?
I'm doing physical therapy right now.
Are you on any medications to help you?
No.
No. And have you seen anyone aside from a physical therapist?
No.
So, based on what you're telling me, Brandy, first of all, you're young, 23, so we need to take care of this and nip this in the bud right now. So what I'd recommend is to see an orthopedic surgeon or a doctor who can start the process and get an MRI. 2 months of back pain, at this point now, if it hasn't gone away and it's getting worse to the point you're calling in to, you do need an MRI to see what's going on. So right on the top of my head, the first things I think about are herniated disc or disc bulge. You know, I don't think this sounds like a fracture. It would have been a subtle fracture, but I think that the cycle needs to be broken. So what I recommend you do is definitely go seek an orthopedic surgeon's opinion.
Okay.
Okay?
Mm-hmm.
I hope you get better, Brandy.
Thank you.
No problem. So, you know, segueing into all of this from Weekend Warriors, I wanted to talk about yoga. Yoga is a very dangerous sport, like football. Believe it? Yes, believe it. I mean, the injury rate in yoga is only 3.5 out of 10,000 people versus 15 out of 10,000 people. But the type of injuries that come from yoga can be devastating, and even life-threatening injuries. 20 million people are doing yoga now compared to 4 million 10 years ago. Now, here's the problem with yoga. The average person looks at it as a simple sport. Everyone who's a yogi deems himself as perfect, that they know it. And most of the classes are just standard yoga classes. I mean, people don't, there's not a variation of difficulty or degree. So you have all age groups going into a class from 20 to 70. I mean, it's neat to have that mix. You have one instructor, and there's a momentum to keep up in this easy sport. And because it's deemed as an easy sport, you know, people try to keep up, and injuries occur. And one of the most classic injuries that occur, you know, that can occur with yoga is, you know, from headstands or shoulder stands. You know, in general, these type of injuries can be devastating. I mean, yoga, I had a lady, she was 72. She said, I'm going to change my life. She used to be a dancer. Her name was Maria, and she was a very successful Broadway dancer. And she felt she was flexible, and she felt, I'm just going to start yoga. And she came to my office with a horrific injury, horrific. As she was doing the shoulder base stand where your head is tilted forward, she started getting, again, she did it, she kept up with her classes, and she started getting acute numbness and tingling down her arm, to the point that she couldn't use her fingers. Right away, within the yoga class, she yelled out, and the class stopped, and they took her to an urgent care. The numbness and tingling settled down, but the back and the neck pain persisted. Brandy had a pre-existing disc bulge, which is not uncommon at that age group. Now, with that disc bulge, basically, what happened was she had continued to have pain when she saw me. And I did an MRI, and she had a 6-millimeter bulge at her lower aspect of her neck, pressing on a nerve. So she had to have surgery. She ended up having surgery, which was a discectomy and a fusion. So the simple point is, this could have all been averted by recognizing, number one, yoga is not meant for everyone. I'm a big guy. I'm not flexible. If I take my shoulder back in a position that I've seen with some of these moves, I'll injure myself. Okay? Mm-hmm. So it's not for everyone. Number two, realize before you undertake the sport that there should be a level of, you should get an assessment, and there should be one-on-one before with a yoga instructor, if you can, to realize what you can and can't do. And if you physically can't do it, or it's tough, listen to your body and don't put yourself in that position, because you can attain an injury that will change your whole life. The last thing you want to do is go into yoga like Maria and end up with a neck fusion. And I can guarantee you she's never going to do yoga again. So great sport, but you have to recognize that it's not meant for everybody, and start slow like any sport. You don't go crazy. You don't start running a marathon before trying a mile first. Mm-hmm. So this is Dr. Raj at the Lifestyle Talk Radio Network. Just listen to me about yoga injuries, realizing that it's probably just as dangerous as a sport akin to football. Thank you for listening to me today. Callers, you can call in at 888-454-3378. Good day.
The opinions you hear on the Business Talk Radio Network are those of